Children's Wisconsin and Rogers Behavioral Health came together to help support kids with chronic medical conditions and comorbidities that were mental health morbidities. So mental health problems, medical problems, how can we help those kids?
These are kids who have stopped participating in most of their usual activities. They're probably struggling to get to school and have a pretty poor quality of life. And so they have parts of their day where they are active, involved in physical therapy, both individually and with the group. And then intermixed with that is the more traditional psychological therapies within the group setting, individual therapies, where they're learning how to manage their pain, manage their emotions to get them functioning physically and psychologically.
Come on and take a seat somewhere?
I feel like Rogers does a great job at treating mental health issues. Children's does a great job at treating medical issues, but up until this program, I don't know of any programs that really did a great job at treating all of them. So we really use a combination of cognitive behavioral therapy, dialectical behavioral therapy, and really behavioral activation. And so we're really teaching them how their mind and their body all work together, how their thoughts certainly can help or hurt them in terms of their beliefs and what they can do.
My brain would then perceive that injury as a threat, right? So
physical therapy in this program has two main approaches. One is education and one is exercise. Kids come into this program and they've spoke to multiple providers, they've got different explanations around their pain, and we try and educate them on why they hurt, why certain things are more difficult that for somebody who didn't have chronic pain would be, you know, just a typical daily activity. For them, it's a painful activity, and helping them understand some of the factors that maybe contribute to their pain, which could include depression, anxiety, daily stresses, and then we try and provide them with strategies so that they can overcome some of those things and return to their previous level of function.
I think the ideal situation is that we're getting kids and teenagers back to like their preferred activities. We're getting them back into sports. We're getting them back into school. We're helping with repairing like relationships between them and the family, because a lot of times there's high stress within the home.
It felt really nice and refreshing.
So far, we've had in the first 2 years over 80 kids come through the program, and what is really goosebumpy is that our outcomes are just smashing it out of the ballpark.
It's just been amazing to see kids come in a wheelchair and in 4 to 6 weeks are able to feel strong physically, believe in themselves emotionally, and just be a kid again and not self-identify as being sick and not being able to do things. It's just been amazing to be part of that team.
Ready, set, go.
For me, it's massively rewarding because in the 4 to 6 weeks of this program, you can kind of turn a kid's life around in a sense and put them back on the right track. Seeing these kids walk in here fairly debilitated and then walk out of here as a typical happy teenager and go back to the things that they love to do, it's a great feeling.